we are officially in the conversation that we promised you. And like we told you, we've got a very special guest who's joining us on the show today. Anaitwa CAS, Dr. Masi Mwangangi. Good morning. Karibu morning vibes.
How are you?
Us guys are good. How are you?
Thank you for having us.
Karibu.
I'm good. I'm enjoying the music. Very nice.
Yeah, you do enjoy reggae music?
I do. I was grooving. I was like, this is how you start a Friday.
Yeah, man. We start with the right kind of vibes. We appreciate you taking the time out to speak to us this morning. And I know that all Kenyans who are listening right now are peeled, waiting to hear what you have to share with us. Now, the country has been in we're in an interesting time. We're seeing the CS talking about there's a rise in COVID cases. What does that mean for the ordinary Kenyan who's listening right now?
Yep. So thank you, Kwambox, and it's always important for me to appreciate you guys for giving us this platform to share with Kenyans what's going on with COVID and the different precautions that they need to take. So right now, when we look at the situation of COVID within the country, CS Motai Kagwe was clear that it seems that now we are in the third wave. And what this means is that when we look at our records, when we look at our admissions at the hospital, we are seeing more people being admitted to hospital. When we look at our ICU beds, and that's the scary bit, when we look at our ICU beds, particularly 2 days ago, it was impossible to get an ICU bed in one of the hospitals in Nairobi, in the private hospital. And so what this is pointing to us is that it seems that, you know, we've gone through our decline in the curve, and now we're having a steady climb. And of course, it begs the question, why is it like this? Why are we seeing these numbers right now? And what we are able to pull out of this right now is that people forgot about the precautions. People forgot about washing their hands. People forgot about wearing masks. People forgot about social distancing. And so we've given the virus time to circulate within us even more. And that is why we're seeing features. And so really right now, I can tell you we're a little bit worried, particularly when it comes to ICU care and oxygen care. I can tell you there's now a waiting line to get an ICU bed.
Wow. And you know, a lot of the people who are listening to us are probably young, and you know, youth look at it like, see, ata ku vaccinate, you don't want to vaccinate people under the age of 18. It means for us it's not a problem. Is that right thinking, or is it really terrible thinking?
So here's the thing, and people need to be aware. Yes, you're young. Yes, you're probably safer. Yes, if you got COVID, for you it might be mild. That is the case. The world over, young people, you know, are getting mild COVID or even moderate, not too severe. However, remember, as you're young, you have your mother, you have your father, you have your grandma, you have the community around you. And those people are very important in your life. And so we are saying that, you know, we want the youth to come in to work with us, to really scream out, you know, scream out loud that, you know, guys, let's get, you know, let's put this in control. Let's adhere to these measures. Let's protect our country. So it's very, very important. And remember, there's a subset of youth who have chronic conditions. Kuna wale kuna diabetes, kuna wale wa youth wako na even issues of hypertension, cancer. So remember, you then become vulnerable, so you can still get COVID-19. And of course, I've seen people on during the weekends, young guys hanging out,
bash,
exactly.
You know, having birthdays and everything else. I know we are tired. I know it's been one long year. We were. But you know what? We have to really be alert. I myself am actually worried. I'm even now masking more. And I'm young. So imagine it's because what I've seen. It's because of what I've seen in the hospital. So really, we need to be careful.
So, Madam CS, with regards to the youth, say anyone say, party, this thing is not going to affect us. How do you intend to sort of get them back into this conversation so that they're more vigilant? Because right now they've moved on, as it seems.
So guys, you're right, and that concern is one that we hold as well. So what we are doing very soon, and I don't want to preempt it, is that you'll be seeing us a lot in the social media. We'll be coming to talk to people like Kwambox and their followers, and you know, ask them to support us, use social media champions, try and engage them. You also understand, because sometimes when someone says they won't wear a mask, there could be many reasons. So maybe we need to understand what those reasons are. Is it that they don't know that a mask is useful? Is it that they don't have money to buy a mask?
Yeah.
Is it that, they have a certain, concern, cultural concern? So
Yeah.
we'll be using you guys very soon, coming to you,
Yeah.
requesting that we with you to mobilize your platform and talk to the youth.
And I can tell you one of the concerns that have been expressed. My nose does not fit in them. I'm just assuming men have big noses that are not fitting in because munavanga mask hivi munacha mapua nje.
Well,
and I've also had people tell me stuff like they can't breathe properly, especially men.
Yeah.
So I think ile oxygen unavutanga haitoshi.
Yeah.
Eh?
Yeah,
I don't know about that.
Tricky. So one of the things we noticed, is that perhaps also there's need for mask education. I've seen people struggling even with the way to actually fit the mask.
Yeah.
If you put the mask by your nose, na hiyo kitu ya bridge finyili kwa pua, the air will keep entering, and when you breathe in, the mask will breathe in the mask. So you feel like you're not breathing. So how to put on the mask is actually very important, and it can help you then be comfortable with the mask, the whole day. So we'll be doing a lot of education, trying to sensitize young guys and reminding them, yes, you yourself, pengine wewe hautapatikana, but trust you me, your auntie, your parents watapatikana. My own parents had COVID, and so I had to take out 1 week to go look after them. So you can imagine.
Are they okay now?
Yeah.
They're okay now. They're okay now. But the thing is, we're a bit worried. You've been hearing us talking about the variants. South African, UK variant. Now we have Brazil variant.
South
Those
Africa,
variants are actually causing severe disease.
So Dr. Now, if don't you think this conversation should start with our leaders? Maybe you should educate them more, especially with regards to rallies. They're not putting on masks.
And I want you to hold that thought because I want you to help us because I know the Council of Governors as well expressed the same concern. Right after the CS mentioned that the numbers are really spiking. So I want you to hold that thought. We're going to play one song and then we'll come back and we'll talk about that. Also the new variant, also the vaccine, AstraZeneca. And the concerns that are there internationally are also these concerns that the ministry is looking at. Remember, we are speaking to CAS Mwangangi. Any questions you've got, guys, remember to use that hashtag Kwambox and Kev. Umesikia tunaongea juu ya COVID na amesema hata kama wewe ni mtoto, uko young, unaweza get COVID maze. Unaweza kuwa na asthma maze.
Ama unaweza ambukiza familia yako maze.
Unaweza kuwa na diabetes maze. Alafu jipate in a dire situation. Bro, mask up.
Morning Vibes, where you are the MVP.
All right, we are speaking to CAS Mwangangi, CS of Health. Na of course tunaongea juu ya COVID kwa sababu na umesikia venye amesema Kenyans ni kama tumesahau, and that's the laxity is what has caused the numbers to rise. I want to remind you, Kevin, that at the beginning of this year numbers zilikuwa down to 90.
Can you imagine?
Mimi nilikuwa nacheza kama mimi. I was even thinking, hey, do I carry the mask? Do I not carry the mask? But I still wore the mask. And now numbers are up to, I was checking yesterday, 800 and that is something.
About 800. That's a huge number. Clearly there's a spike and it's a cause for concern.
Yeah, and more of a concern is the fact that ukiget msik sahi, labda ni father yako amekuwa msik ama granny, unamkimbisha kwa hospital hapo ICU. Imagine, and you know when you're taking someone to ICU, it's at that juncture that the doctor must take this person and treat them. Imagine kupanga line.
Imagine. Unapanga line alafu unaambiwa kuna bed.
Imagine.
After being on the line for a whole whatever time. So I'm excited because now we have Dr. over here, CAS of Health, Dr. Mwangangi. And the question I want to throw to you, Dr. is especially with regards to now people being more vigilant, especially the youth. What about our national leaders? You know, we've seen around right now, politics has been heightened, the energy out there. Guys have hit the road. Yeah. Guys are preparing for 2022.
By elections are crazy.
Yeah, but
people are gathering. And
it seems like they're not taking this COVID thing seriously, especially after the fact that former Premier Raila Amolo Odinga has just tested positive of COVID. What are your thoughts? Is it possible for them to actually take it seriously, possibly postpone matters, rallies, you know?
Yeah, so I mean, one, again, very worried about that situation, and that is why you saw Waziri engaging COG yesterday. Remember, COG governors are also politicians, and so they were coming together to say, you know what, we need to put our foot down. We need to really, sensitize our colleagues, our fellow politicians, and really ask for order. And that we are doing. You'll be seeing, going forward, very, very, how do I say, affirmations of, come on guys, can you conduct this yourselves in a manner where, you're leading the people and protecting the people.
Yeah.
But also, there's a flip side to this. Kama wewe unaamka, na unasikia kuna rally, kuna msee amekuja hapo, there's a politician, unajipeleka. Kwani ni nani amekuvuta hapo?
Hata ulipwi.
Seriously.
Yeah.
Yeah.
And I keep hearing and asking people, So you're driving around, ama unatembea uko kwa shughuli zako, unaona watu wamekusanyika, then you join them.
Yeah.
And you don't even have a mask. Now, what do you want us to do in that situation? You're not being forced.
Yeah.
So kuna ile story, individual responsibility, and we've really been, hammering it. Na saa ingine tunaona people are making memes about it, they're joking and saying, why are we saying individual responsibility? But ukienda kwa rally, uulize hao watu ni nani alikupeleka hapo. Ni yeye mwenyewe.
Yeah. But CS, I mean, also Kenya is a country that politics is, yani, tunakula, tunakunywa, tunaota, tunamari politics, So, and you said, okay, so no one is forcing you to go there, but there's always incentives that's given to people to attend these rallies. I remember this Council of Governors recommendation was to the president to ban rallies for 30 days just to bring this thing, to calm the situation. Because if you're telling Kenyans, wait, jichunge, I'm telling you tutafika 5,000, because if rallies are still going on, if, bars are still open and clubs, mimi kutoka kwa nyumba.
How? Yeah. And my leader is there on a rally.
And that's the thing right there that we've been, how do I say, dealing with and wanting to sort of address when it comes to the Kenyan individual. Remember, you're still going to school.
Yeah.
You will not ban schools. Remember, we are still going to markets.
Yeah.
We will not ban markets. We need our food chains to continue.
Yeah.
Remember, people are still coming together, even for businesses. And that is why, government has adopted a report, an approach where you can still allow for restaurants to continue thriving up to a certain hour. What we are asking, and really when we look at the world over in terms of best practice, if we focus on that individual, where mwenyewe, even with that incentive for you to go to that rally, are you walking there with a mask?
Yeah.
That's the big thing. Are you going there and then, I've even seen people pulling them out
to show their face. Yeah.
So you wonder, why are we doing this? And yes, we have advised, we've given our advisory. We'll be waiting on the president today. We'll be making the next, announcement in terms of what next for COVID-19.
All right. We have CAS Mwangangi. I think we're having some technical issues there with network. But umesikia amesema the president today will be addressing the nation and speaking about the recommendations that she gave. Now, here's another question. Because clearly now it's down to individual responsibility. I was having this conversation with someone this week, and I said, Kenyans, we need to adopt and understand that si ati imeisha sasa turudi back, because you find people saying I can't wait for life to go back to normal. And not realizing that this is the new normal. How, in your expert opinion, how long should we just adopt the idea of wearing masks? Yani, in the near distant future, unaona labda one day, maybe in 2027 is when we drop masks. Because Kenyans are not, what you're speaking about is adopting it and making it part of your life. Even if you're going to that rally, put on your mask. Even if you're going to work, put on your mask, because we're not going to shut anything down. But Kenyans haven't adopted it. They're still wanting to go back to normal. Are we ever going to go back?
And Kwamboka, that's a good observation. So we've looked to Mwangangi and we've tried to ask ourselves, we'll look at through past history, which is the last pandemic that ever hit the world, and how long did it take to get to a new normal? And I can tell you, sometimes all the way to even 4 years in, we're still adhering to these measures. So in comes the question: how do you how do you invest in people understanding it's really a personal responsibility? Let's look at South Korea, let's look at India, let's look at Japan. Those guys wear masks. It's actually part of their part of their uniform, part of their clothes, part of their dressing. And that's because they appreciated that this mask protects lives, and then you come to learn to live like that. One of the interesting things that we need to share with people is that even when we vaccinate, even as we continue to vaccinate, you're in a manisha to the end of this year, you will still be required to wear your mask.
Even after Kula AstraZeneca?
Yes.
Hiya.
But let me ask you something.
Be required to wear your mask and to wash your hands and to social distance. And the reason is this.
Go on.
Right. And the reason is this. when we are doing a vaccination campaign, you want to get 60% of the people vaccinated. Ndio wakapatia ile kitu mnasikia ikiitwa herd immunity. So herd immunity is a situation where you have to protect 60% of your population to reduce risk of transmission. Now, the current vaccines tunatumia, one, for us to get to 60% right now, it's going to be impossible because the supplies are not enough. World over. Watu wanapiga queue. Watu wanapiga queue kupata hizo vaccines. In fact, even for us, we've had to fight. The vaccines you saw coming here to the country at a point could have been coming in. We had to fight to bring them now. And we only got 1 million doses. To the end of all, you can imagine, we'll need almost 25 million doses to get to a percent population.
So you need project 2030.
So hii project yetu inakaa kama itaisha huko, not even kuisha, inakaa kama itafika 30% in 2023.
2023. That's oh my god. So Dr. What about going back to a partial lockdown? Because I saw it worked in Australia, New Zealand, France also tried to implement it.
Thing, and those are the Thank you. Sorry, I'm jumping in, but those are the difficult choices we are having to make. We were in the boardroom and we're trying to decide what do we advise and how can this look like. You can imagine right now the recessions that countries are in, economic disruption, ile imekuwa, issues are job, issues are work. So if you keep locking, opening, we've been told by the scientists, this may be the situation. Lock, open. So the country has to decide for itself what is the moderate approach. Because you want to ensure watu wako na kazi, but that they're still following the measures. So that is what we are grappling with, and I can tell you no country has an answer. I've seen even New Zealand wamefunga tena. So it's interesting.
So it's likely. That's what you're saying. You're saying it's likely, basically.
So again, it drives us.
Sorry, Kwamboka. If things go all the way down as they are increasingly looking like, those are always possibilities on the table.
So that's why you're insisting that it boils down to individual, because because I know that a lot of Kenyans gave up, and CS, allow me to say this. When we started the conversation around COVID last year, there was the, collective responsibility by every Kenyan. This is hitting our country. Let's all rally behind and help the CS, help the Ministry of Health combat this. I'm playing my part. Then what happened? What had happened from where I'm sitting here, they started having rallies. All right. And Kenyans started to believe that this thing is not true. Right. And then you remember also the stats that we had in terms of how the deaths are going to happen by August, and that didn't really hit us the way, it hits internationally. And so public participation in trying to keep this down sort of waned, because now people are focusing on, fungueni nifanye kazi, fungueni niende kwa club, fungueni niendele na maisha yangu. And then there was this, when you look at your leaders, and leadership plays a big part. It's why I'm very excited that the COG has recommendations which start with the leaders. Political rallies took shape, started this year with a bang, And so if you ask the ordinary Kenyan, are we still combating COVID? They'll tell you, hakuna COVID, hiki tulimanufactureiwa. But here's the interesting part. Let's talk about the new strain, because we've seen some posters in some hospitals telling people that there are some new, what they call symptoms to be looking out for. To our listeners who are listening right now, what are those new symptoms that they should be looking out for?
So again, a new observation with COVID-19. I was talking to some doctors just the other day, and they were telling me, the clients who are coming in are having symptoms that are not the typical. In the beginning, we were really clear. It was a cough, it was a fever, it was difficulty breathing, very, very, very chest-oriented symptoms. Mambo ya mafua, But now, what we are seeing now is those symptoms continue. But we are seeing rashes. We're seeing people coming in with rashes. We're seeing people coming in with clotting issues. We're seeing people coming in with diarrhea, symptoms of stomach, what we call the gut symptoms. Compared to chest symptoms. And again, this is making us again wonder, do we really understand this disease?
Exactly.
Because right now, in the beginning, we thought this is a purely respiratory disease, meaning a purely chest disease. We've even seen people getting strokes now.
What?
Wow.
With this disease. We've seen people getting, clots in their blood because of this disease. So really, and one of the phenomenons from last year, we also saw this disease giving people diabetes, high sugars, climbing very high. So it's a disease that I can tell you, we continue to learn and understand it. And new information keeps coming up.
Yeah.
And so because of that, the important message here for you at home is that, one, be aware. If your parent, if yourself has a certain sign, symptom, present yourself to the health facility so that you can undergo the proper testing, so that we can know how we can take care of you. That's the key message. So let's not just think about the coughing and the sneezing. Remember, particularly for our old parents and our grandparents and aunties, it can be many other symptoms.
Let's talk AstraZeneca. We have reports that Denmark has banned this, 9 countries in the EU, because they've seen new symptoms, and then they're saying, okay, fine, we cannot confirm conclusively that this blood clots that we're seeing are from this vaccine. But then having them ban them, and we have reports that Kenya has just received 100,000 vials of that particular one. And this is one of the vaccines that the Ministry of Health has approved. Should Kenyans be worried?
Right. So we did see the report from Denmark, and yesterday we actually held a meeting with WHO and reached the headquarters trying to get a way forward on this.
Yeah.
One, what we have in terms of Denmark is that they have not necessarily banned, the vaccine in that, no more AstraZeneca, throw those doses away.
Yeah.
What they've done is that they've instituted an investigation process.
Yeah.
And it's important for us to know this because even here in the country, we actually have a committee that will be monitoring vaccine safety.
Yeah.
And it's a committee that has existed, that has been doing this work for a very long time. Things like polio, BCG, they've been monitoring for us.
Yeah.
And so now their eyes are on COVID.
Yeah.
Just the same way Denmark authority was looking at the evaluations for AstraZeneca. Now, in terms of the trials, Mnakumbuka, we kept telling you it is safe.
Yeah.
We are going through trials. When trials were done for AstraZeneca, did not show any causal effects that ukipata your vaccine, utapata hizo clots. Those results were not seen in the trial, and I can tell you these trials involved almost 1 million people across the world.
Yeah.
So therefore, the vaccine passed the safety test.
Yeah.
However, ukipewa dawa yoyote or even a vaccine, there's something that we usually call adverse effects. There's a monitoring system to check how the population will react. And clots inakuanga kwa ile category ya severe adverse effects. So even if I'm giving you paracetamol or an antibiotic, and I see that out of 1 million people, 10 have clots, the right thing to do, the precautionary thing to do is to pause and quickly check.
Yeah.
And so right now, as we do this, another thing that people need to understand is that the AstraZeneca vaccine has been manufactured from 2 points.
Yeah.
Kuna ile that was manufactured from Europe.
Yeah.
Na kuna ile that was manufactured from India. The one that is in Kenya is the one that came from Serum Institute, India.
Yeah.
And in India, there will be no reports of clots.
Yeah.
That is why we are continuing right now.
Yeah.
As we wait for more information from the other batch.
So, Madam CAS, of course, the country, and we have history of fake products, nini.
Yeah.
What is the government doing to avoid the potential of fake vaccine in the country, in the society?
And that's a legit concern.
Yeah.
Yeah. But that is a super legit concern.
Yeah.
I wouldn't want to get Maggie or other funny things in me. And what we've done, it has happened in the world, across places it happens. What we've done is this. And I want you guys to challenge me and go look for a nurse or a doctor who has already received the vaccine.
Okay.
You will notice wamepewa a message, kuna SMS wamepata.
Yeah.
And the SMS says something like, hi Sheila Kwamboka, congratulations for receiving the COVID-19 vaccine. Your vaccine was from batch number X2310/1015. Your next immunization is on 10th May. If you go to any doctor right now, they'll show you that message that they've been given, the ones who've received the vaccine.
All right.
So that tells you, ukipata vaccine, monitoring the batch number. So we have the batch number we can trace.
Yeah.
So if someone is giving you a vaccine uko inje, you can actually come with our system of what that batch number was.
Yeah.
So this time around to prepare, we are
Alafu, the only specific places that you can get vaccinated in the country are like referral hospitals. Where else?
Yeah, so and that's important. So phase one ni madaktari na nurses wale watu wanafanya kwa hospitali. That's what we are focusing on. Phase 2, 50 and those with chronic conditions. If you're 18, 20, below, whatever, but you have a chronic condition, that is phase 2. Now, where can you get the vaccine? Right now, today, the vaccines are available in Kenyatta, in all the referral hospitals, in all the level 5. Izile zilikuwa the old level 5 hospitals, Machakos, Embu, Nyeri, Kisii, Russia, in Kisumu. It's available there. As well as the county referral hospitals. They're also available there. We've also started distributing it to private sector. So as at today, Nairobi Hospital have it, Aga Khan, Coptic have and a few other hospitals have it. The list is going to be on the MOH website. If you want to know, unaenda to MOH website, unaona the list.
So you can know.
And so the vaccine will be free. That's important for me to remind people.
Free.
It's free.
Yeah.
It's free for it.
All right.
It's free.
So thank you so much. What I'm watching and what I'm seeing is that we clearly need to work together, media and MOH, because there's a lot of information that could be disseminated. And you can imagine, kuna msese amesema, mimi niko na asthma nakimbia kwa hospitali. How do you know that it's my turn to go and get the vaccine? And understanding, I think for me the key thing is I've understood, and what every Kenyan should take out of this conversation is that it boils down to me and you. Even if you're not,
personal responsibility.
Even if you're not going to get the disease, the fact that we're talking about lockdown because of your irresponsible behavior, you're not taking part, it can affect you economically.
Oh, by the way, Madam CS, final question. Kids, when are they going to be vaccinated?
Yeah, so good question. So guys, these vaccines have not been tested in people who are under 18 years of age.
Yes.
So because of that, because no trial, none of them, Pfizer, Moderna, Astra, none of them have done trials in guys who are under 18.
Yeah.
I think about 2 weeks ago, Pfizer walianza to test in under 18. So because of that, the vaccine shall not be issued to anyone who is under 18 years of age.
For now.
That's one. Number 2, the vaccine has not been tested in pregnant women. So to say when a mama and you're diabetic, now exactly ukona ball and you're diabetic or you're hypertensive ama ukona renal disease, right now no trials have been done in pregnant women. However, tunasema hivi, when we look at the trial information, particularly for AstraZeneca, it's showing us zile panya, na najua mtacheka, but zile panya zilitumia in the trials, rats that were used, the pregnant rats, there were no ill effects,
no side effects
in the pregnant rats. And so if you're a healthcare worker, if you're a healthcare worker and you're pregnant and you're working in an ICU where you have the high risk, what we are saying is that it is up to you to decide.
Wow.
To make an informed choice.
So, wow, this is very interesting. Thank you so much. And I know we're going to be speaking some more. We can't wait to see what the president will say. You said the president will be talking today about the recommendations by the COG.
Hopefully, yes.
Asante sana kwa kazi mnafanya.
Thanks a lot.
And for the info that you've shared with us, I know Kenyans are now more informed.
Vibes Radio.